Yes, I understand that. And also, you can't say they can't be investigating fraud. They must be, but it has to be fraud across the board that you look into, not for a particular segment of the medical practice. So what's the way forward now? I mean, I heard you mentioning it. You don't think a final report will come to a different conclusion from this one that you have now received, Minister. What should we expect to be the next steps?
Yeah, this is a final report, Raden. The interim one came in 2021, and all the people who were fingered, the medical schemes, they were asked to respond because the ones that were fully investigated were the biggest three medical schemes, which is Discovery, which is GEMS, which is Med Scheme, because they constitute 80% of the membership of medical schemes. So they were given a chance. They were saying, this is our preliminary findings about you. Can you comment on them? Can you challenge them?
Yes.
Can you provide more evidence? And they were given, that took 4 years. And finally, Advocate Ngugaitobi, Tembeka Ngugaitobi, Senior Counsel, was saying after they made their inputs, it did not change the interim report. They were not convinced that anything has changed. And that's why they brought the final report one. Now, the report has got recommendations. The recommendations are to the schemes oneself if they really want to change. The second recommendation is to the Council of Medical Scheme, which is the statutory body regulating medical aids. And the third recommendations are to myself as the minister in terms of legislation, that perhaps because the section 59 of the legislation